Welcome to the Exam Room Live, brought to you by the Physicians Committee. Hello, I'm the weight loss champion. You can see joined by Dr. Robynne Chutkan, and today we are going to be talking about getting rid of acne and pimples and blemishes, all kinds of things with your skin that you really don't want. And we're going to introduce a new concept for treating skin issues, a little something called the gut-skin connection. We're getting into it. Gut balance here on the show today. Indeed, we are talking all kinds of skin health here on the Exam Room Live, brought to you by the Physicians Committee. Hi, I am the weight loss champion, Chuck Carroll. Appreciate you raising your health IQ with us in more than 150 countries around the world and making the Exam Room one of the most consumed nutrition podcasts anywhere on the planet today. And it is a fact, my friend. I don't need to tell you this, but I will anyway. A poor diet can destroy healthy skin, but a good diet can help to bring back that smooth, clean, fresh-faced look. And that's what we're talking about today, how to treat acne and eczema, rosacea, psoriasis, and other skin issues using a gut-based approach. And doing a deep dive with us is a fellow podcaster with a ton of medical credentials. She is board certified in gastroenterology. She's an author, a long-serving faculty member at the Georgetown University Hospital, and founder of the Digestive Center for Wellness, and her name is synonymous with gut bliss. She is Dr. Robynne Chutkan, and she's here with us talking all about your skin and your gut today. And the fact that treatment options, they just don't always have to be limited to expensive procedures and messy creams. And here's the cool thing, Dr. Chutkan, the exam roomies are with us live, so if there's a question you have, my friends, drop it in the comments or in the chat. We're going to get to as many as we can when we open up the doctor's mailbag in just a little bit. But officially now, welcome Dr. Chutkan back to the show. Great to see you again, Doc.
Thank you so much for having me. It's always so great to be on with you. And I love the introduction because usually people are like, yeah, she's a butt doctor. But I love, synonymous with gut bliss and author. And that's so much better than, yeah, my butt doctor friend is here again. Good to see you.
Butt doctor. Yeah.
Lowly butt doctor.
Is that what it says on your business card? I hope not.
No,
I mean, it's a lot
no.
shorter than everything that I said. It would fit nice and neat, but it's just, I don't know, uncouth.
And Chuck, the gut is having a moment. As you know, I always like to point out to people, look at where your gut is located. It's right in the center of your body. And it is the engine for your entire body, for your brain and your lungs and your immune system and your skin. So what you feed your gut is really essential for how you want your skin to show up, and what you put into your gut shows up on your skin. So there's this really close connection. In fact, I like to think of it as the skin is the outside of our gut and the gut is the inside of our skin.
Ooh.
Because think about it, if you put lotion on in the morning, you don't look like you need a lot of lotion. You look very moist, but I tend to be a little on the drier side. So when I put lotion on in the morning, in like an hour, it's gone. Where did it go? Our skin has literally eaten it. It has ingested it. And similarly, when you eat stuff, it gets absorbed through your gut lining into your bloodstream, and it gets carried to the different organs, including your skin. So there's this really close connection.
I am very curious to talk more about that, but don't let the fresh face fool you. I definitely have dry hands, very, very dry hands, and they soak up a lot of lotion overnight because I sleep with the mittens on.
Ooh,
so maybe
romantic,
isn't it though? My wife tells me I'm still a stud and not to worry about it.
You have the night guard in too, the night guard and the mittens, and
I mean, I might,
socks.
and I might sleep with those little things under my eyes too. I don't know. It could be a completely different person when the cameras aren't rolling. No, I kid. But no, I am serious about the mittens. Anyway, whatever. Let's get into this. You said that the big four were acne, rosacea, psoriasis, and eczema. Let's start with acne because I think that that's really a condition that has affected literally everybody on the face of the earth at one time or another in their life. We hear a lot about it with teenagers. You go through high school, the hormones are changing, boom, your face just explodes, whether you want it to or not. But as we get older and those pimples are still there, how common is it for an adult to be struggling with acne specifically? And is it really more often than not driven by their diet?
It is almost 100%. Well, I shouldn't say 100%. There are dietary factors in almost everyone. It's true that there are hormonal reasons, etc., but about 30% of adults still struggle with acne. So it's a huge problem in adulthood. And even in teenage years, if you go into a typical high school, you might see 30% of the teenagers with absolutely clear skin, 30% with really, really severe cystic acne, and then another third, well, 30% isn't exactly a third, but 33 and a third percent with a little bit of blemishes. And I'll tell you that that is not genes or hormones or anything else. It's an interaction of all of it. So acne, like a lot of conditions, there is a genetic predisposition, but the genes alone don't create the condition. It's the environmental trigger. Now, what are the environmental triggers for acne? In teenagers especially, it's diet, because the hormones are changing and the hormones are triggering the sebum in the ducts, and the sebum is being produced. Sometimes it's blocking the ducts, but all of that is influenced dramatically by what people are eating. The other thing to think about in teenagers is antibiotic exposure. So those very same antibiotics that the dermatologist is telling you should use to treat acne are the antibiotics that in childhood can mess up that gut microbiome and predispose someone to acne. So you have to think of it not just as it's hormones or it's age or it's medication. It's all of these things. It's a genetic predisposition plus the environmental triggers of diet and lifestyle. I want to mention stress, both in teenagers and adults, major contributor to acne.
I'm really astonished that something that we might ingest is a younger person would still affect us later on in life. And I know that also with acne and other skin conditions as well, a lot of patients are put on long-term antibiotics. Maybe it's a lower dose. Is that kind of doing more harm than good in the long run a lot of times?
Terrible idea. But here's a problem, Chuck, and you know this well. Medicine is siloed into different boxes. So I'm the gastroenterologist. My main job is to treat your gut problems. The dermatologists are focused on the skin. The fact that they are disrupting your gut microbiome, setting you up for autoimmune diseases later in life, not their problem. It's not on their radar. It's not that they're trying to create problems, but really their goal is to clear up your skin. And long-term antibiotics can do that, but here are the risks. Number one, the bacteria eventually going to become resistant to the antibiotics. So they're going to have to use stronger and stronger antibiotics, and eventually they're going to stop working. Bacteria are pretty smart. They know how to hack an antibiotic. The even bigger issue, though, is what it's doing to your microbiome. We know that 5 to 7 day course of broad spectrum antibiotics can remove about a third of the bacteria in your gut. And this is a problem for us as adults, but it's really devastating for teenagers because their microbiome is still forming. So we have study after study showing that antibiotics in childhood, that's associated with autoimmune diseases later on, like Crohn's and ulcerative colitis, even psoriasis, actually. So while we're trying to, dermatologists are doing their best. This is what they know how to do. They're trying to clear up your blemishes. In the process, they are setting these young people up for autoimmune diseases. They're setting them up for mood disorders, because we know that disruption of the microbiome with antibiotics is also linked to depression, anxiety, mood disorders later on. They're setting them up not just for gut-based immune disorders like Crohn's and colitis, but we see an association with antibiotics and things like rheumatoid arthritis and MS, etc. So, I remind people all the time, just because something works doesn't mean it's a good idea. So because an antibiotic like doxycycline or tetracycline may help to suppress the bacteria on your skin and clear up your acne, it doesn't mean it's a good idea. That acne might actually get more severe over time as you become resistant to the antibiotic. And now you have created a lot of potential problems with autoimmune disease, bloating, mood disorders, etc. So we have to be a little more holistic in our approach as physicians, and think about the whole patient and not just the problem right in front of you that you're trying to solve.
Well, let's kind of flip the script and take more of a general, 10,000 foot view when it comes to antibiotics, because there are going to be some appropriate times when a person should be prescribed antibiotics. Just for clarity here and to clear up a little bit of confusion before the chaos sets in, could you elaborate a little bit on when those times might be?
Absolutely. And I want to be clear, antibiotics are probably if not one of the greatest medical breakthroughs of the last 100 years. We're right at about 100 years now, in the late 20s. They have saved the discovery of penicillin by Alexander Fleming has saved millions of lives and will continue to save lives. But now we're in what I like to call Pharmageddon, where the pendulum is kind of swinging the opposite way. So now we're seeing widespread antibiotic resistance, which threatens to plunge us all back into the dark ages of medicine before we had any antibiotics. Because if our bacteria are resistant to the antibiotics, they don't work. So we're seeing widespread antibiotic resistance. And a big part of that, it's not just the antibiotics that physicians prescribe. It is also the antibiotics that are used in the animal industry. The number in the US is about 70 to 80% of all the antibiotics used are used in the animal industry. For example, they're given to cows prophylactically, to dairy cows to prevent infection. They're given to animals to help fatten them. So they're used a lot in the animal industry. Just a word of advice there about the fact that even if you're judicious about not taking antibiotics, you may still be getting exposed to antibiotics in the food you're eating if you're eating a lot of animal protein. So you have to think about that. So there is a lot of antibiotic exposure. And there are times, Chuck, you asked, when do you need an antibiotic? So antibiotics, you've got a life-threatening infection. Absolutely. You've got pneumonia, you've got meningitis, you've got cellulitis. But here's a problem. Many, many times antibiotics are being used prophylactically, meaning they're being used to prevent an infection that may happen. And oops, there goes my light. That may happen. We have no light.
Live
We're
shows,
still
man.
good.
You gotta love the live show, right?
Right. Got to make it exciting, right? If the light doesn't fall off and crash onto my foot, it's not an exciting show. Okay. So we have a situation where antibiotics are being used to prevent a potential infection. And a classic example of that is you go to get your teeth cleaned and you may have abnormality of your heart valve called mitral valve prolapse, which is really common. There are literally millions of people in America who have this very mild abnormality. Decades ago, it was thought and it was shown that when you do something like have a tooth cleaning, it dislodges bacteria in the mouth. And those bacteria can seed the valves of your heart and create a problem called endocarditis, an infection of the heart valves. But now we have pretty clear evidence that the risk of something bad happening from the antibiotic, something like Clostridium difficile, a serious gut infection that can cause terrible diarrhea, end up needing to remove your colon surgically, it can even kill you, that the risk of things like C. diff are much greater than the risk of endocarditis in the average person who has mitral valve prolapse. Now, if you have an artificial heart valve, that's a different story. You may need to get antibiotics. So what we've seen, Chuck, is a gradual change in some of these policies. I helped to write the guidelines in gastroenterology for antibiotic prophylaxis if you're coming in for a colonoscopy or upper endoscopy. And over the years, we went from, let's give antibiotics to everyone to let's be more judicious in who we give antibiotics to. So we don't give antibiotics prophylactically for people with mitral valve prolapse. We don't do it if you've had even a joint replacement, unless it's fresh, you just had surgery. So it's a smaller and smaller group. Now, your dentist or your gastroenterologist might not be thinking long-term about your gut microbiome. They are focused on preventing an infection from their particular procedure. And so sometimes you have to push a little bit. You have to say, are those antibiotics actually necessary? Or could I just take the prescription and, start them if there's obviously a problem? So we see a lot of prophylactic treatment. We see a lot of treatment for self-limited infections that will get better on their own. I see people all the time who show me, I have a little thing on my fingernail hair. And, my doctor gave me an antibiotic. And I'm like, well, that's going to go away in 48 hours with some, warm soaks, maybe a little tea tree oil or something. So we're giving antibiotics for minor self-limited infections. And then one of the biggest categories, we're giving antibiotics for viral infections. Antibiotics have no utility against viruses. Antibiotics don't kill viruses. Biota being, in this case, bacteria. So we are using antibiotics for viral coughs and colds. We saw it during COVID. Now, if you had COVID, which of course is a viral illness, SARS-CoV-2, and you had what we call superinfection with a bacteria, you had a pneumonia on top of that from bacteria, which some people get, sure. But a huge percentage of the people who received antibiotics for COVID did not have a bacterial infection. They had a viral infection. And Chuck, what do the antibiotics do? They kill off the bacteria that are actually essential for fighting viruses. So antibiotics in the setting of a viral infection can make you sicker. We have a study looking at rotavirus, common viral infection in children causes diarrheal illness, showing that children who receive antibiotics in the few weeks preceding getting rotavirus do worse. They are sicker, they have more severe infection because their little bacterial soldiers who are going to help them fight the rotavirus have been killed off. And we see the same thing for influenza. So these are the three big categories to be aware of. Prophylactic antibiotics to prevent an infection that's probably never going to happen. Antibiotics for mild self-limited coughs and colds, cuts and scrapes, and antibiotics for viral illnesses against which they have no utility. And so those are the things to ask your doctor. In my second book, The Microbiome Solution, I have a pretty useful table in there, 10 questions to ask your doctor if you've been prescribed an antibiotic. And number one is just kind of common sense, right? Is this antibiotic actually necessary? And then what would happen if I didn't take it? What are the signs and symptoms I should be looking for? Could you use a more narrow, broad spectrum antibiotic that's not going to willy-nilly, destroy tons of different microbes, but could be more targeted? So these are the sorts of things. And this is why I love your podcast. And I was moved to become a podcaster myself, because once people have these tools, they can have a much more informed decision with their healthcare practitioner, and they can have a dialogue rather than a monologue of the physician just telling them what to do once they know the right questions to ask, the right things to look for.
Yeah, and I feel like we could do a completely separate podcast, probably a full 10, 11, 12 part, 20 part series on this, but I think the bottom line is as a society, and it's not a problem limited to the United States, but bottom line here, I think that we're just overprescribed. So it's not that all antibiotics are bad, as you said. It's just like we got to stop making that the default treatment. Give your immune system time to work. So use them when necessary. But we'll circle back to that on a future episode. But I want to circle back to now the topic of the day and skin health. And even though that all goes kind of hand in hand, let's talk specifically about acne. I know that right now a lot of people are tuning in. They're like, okay, let's talk acne because God knows I got some things on my face that I don't want there anymore. What are some of the more common foods, Dr. Chutkan, that are big time acne contributors?
There are three big categories. Ultra-processed foods is one, dairy is a second, and refined sugar is the third. So ultra-processed foods, we now know that most Americans are consuming about 55% of their calories are ultra-processed foods. And so that would include the obvious, the sort of Cheetos and Doritos, soda, diet soda. Beware of the new thing now are these prebiotic sodas that are claiming to be health foods. This is an ultra-processed food. Once you start seeing those listed chemicals, so there's a wonderful classification system developed by a group in Brazil called a NOVA classification, Nova. And actually in my last podcast episode episode before, the one from last week on acne, and in this week's on psoriasis also, I do have a link to the NOVA classification and several other helpful links. But really, this is a simple way. If you look at a food and you start reading the list of ingredients and you don't have them in your pantry, it's an ultra-processed food. I don't know about you, Chuck. I don't stock soy lecithin and carrageenan and sodium phosphate and, carbonic acid and natural flavor. Whenever you see natural, that's a red flag. That's super unnatural. So anything that says natural flavor, natural coloring, run for the hills. That means it's straight up chemicals.
There are countries where I believe you cannot list natural flavors. Like there just can't be that cloak. They actually have to list the ingredient. I think that one of the ones that shocked me, and you will have to fact check me, so don't take this as fact, but I do believe that hair has been used as a vanilla flavoring somewhere. Fact check me on that. I'm not stating it as a fact, but I'm pretty sure that is one of the ones that is out there. And that's just wacky to me. And I think that of all the additives, hair might actually be the least scary of them.
You're right. It's from nature. Yeah.
Right.
So when you start to think about a food, think, did this food make its way from a farm or the ocean or something to your plate, or did it come out of a factory? And so if you think of like potatoes, okay, you look at some potatoes, sure. Potato chips, there's no potato chip tree or branch or bush or anything like that. So potato chips are an ultra processed food some of the time, not all of the time. If you find a potato chip and the ingredients are potatoes, oil, and salt, that's very different from a potato chip with, 18 ingredients. So even within processed food, there's processed and there's ultra processed. And the problem with those preservatives, emulsifiers, et cetera, is that they're destroying our gut microbes and they're damaging our gut lining. And those are the two processes that lead to problems in other organs like the skin. So when you kill off a lot of the healthy bacteria in the gut, you now have created an imbalanced gut microbiome, and that's going to lead to an imbalanced response in other organs. When you damage a gut lining, it now means that toxins and partially digested food and other trigger things can get through the gut lining into the bloodstream, get to distant organs. So that's really the connection between the gut and the skin, is what's being absorbed through the gut, getting into the bloodstream, carried to distant organs like the skin and the microbiome. And then how is that factoring in with the immune system?
Well, let me ask you this, going back to the potato chip example. So even if it is just oil and salt in there, a lot of people think that if you eat an oily food, that kind of like seeps back out of your pores and you get this kind of greasy complexion, and that can cause acne as well. Is there any wisdom to that notion, or is that an old wives' tale?
No, well, there is some truth to it in the sense that greasy food like cheeseburgers and a lot of French fries, pizza, things like that, absolutely. But it's not the oil itself. So if we look at populations that eat a diet with a lot of oil, like Mediterranean population, and I'm not talking about modern day Rome, where unfortunately there's a lot of processed food, but at more traditional Mediterranean communities in Italy, for example, they eat a ton of olive oil, high percentage. They don't have acne. So communities that eat unprocessed food, and a lot of them overlap with the blue zone. So if you look at parts of Japan, and even where the diets are completely different, if you look at a traditional Inuit population in Alaska and parts of Canada, they're eating a high fat diet, but no processed food, they don't have acne. So it is really the combination of the oil, how you're eating it. You're eating a lot of fried, processed foods, as opposed to just having, good quality olive oil that you're cooking vegetables and maybe some fish in. So it's not just the oil itself, it's what you're eating. Again, oil from avocado is different from oil from pizza. And I think that's an important distinction.
That is a huge distinction. Let's go ahead and open up the doctor's mailbag, because there's a great question from Stephen that I want to bring up. All right. Stephen's question is this. It's so good. It's about chocolate. I think that it's almost impossible, Dr. Chutkan, to have a conversation about acne and not bring up chocolate. And so Stephen, kind of more of a comment than a question. He says, when I was younger, we were told that chocolate bars had no effect on acne, but it sounds like they are one of the worst choices in actuality. So chocolate bars versus, I'd say, raw cacao. That's kind of where this discussion needs to begin.
Stephen, great question. And you're 100% right. Chocolate bars have a huge effect on acne. Now, raw cacao is different, but that's not what we're eating. Actually, nowadays, there's better options for chocolate that really are dairy-free and some that don't have sugar. We don't want sugar-free and artificial sweeteners, but some that have a low sugar content, maybe a little coconut nectar and more cacao. But the typical chocolate bar that you think of, like a Snickers or Three Musketeers or, any of those, and not to just call those out, but the typical candy bar and chocolate is absolutely, between the sugar, the dairy, all the other processed ingredients, absolutely a trigger for many people for their acne. And, I have lots of dermatology friends and they're wonderful people. So I don't think it's that they know and I think they're unaware. And within their field, this is what they do. I remind people, physicians are not health advocates. Physicians' job is to diagnose and treat. And what they have, most of them in their toolbox to treat, are drugs. So it's kind of like, I don't know, like going to the hair salon and asking for a pedicure. Although that's not a good example because you could probably get that. It's not what they do. Like you go to a dermatologist, you start asking about diet. They have no training in diet. That's not what they do. They're there to dispense a drug. And so we have to look a little bit beyond that. And, we have to be careful where we look because there's a lot of nonsense supplements being sold, etc. But look for just more good advice about nutrition. And my best advice for people, the same way I am not recommending doxycycline or tetracycline as a long-term solution to your acne because it's going to cause more problems, I'm not recommending a supplement that you find on the internet either. I'm recommending really look at the inputs. What are you putting into your body? And is that in some way being reflected in the output on your skin, your bowel movements, etc.? Now, it's not all controllable, right? There are other things. You may have a strong genetic predisposition. You maybe have been given tons of antibiotics as a child. You may be on some other medications that are irritating your skin. So I don't want to suggest that if you have acne, it's your fault and you're a terrible person and eating terrible food. Please, not at all. This is all about empowerment, not blame. I created a guide called a Gut Bliss Guide to Healthy Skin. You can find it at gutbliss.com, GUTBLISS.com, under Gut Guides. And that goes over products and skincare ingredients to watch out for that can irritate acne, how to cleanse your skin using just a mineral water spray and a cotton pad, and then a long section on foods to avoid, trigger foods, foods that can help, as well as edible recipes for your skin that you can whip up in your kitchen, things using a little bit of manuka honey, etc. And I have found these things to be so helpful. One of the things I notice in my GI patients is that when patients come in with an inflamed gut, their skin is often inflamed, whether it's acne or eczema or often rosacea. There's a strong connection between rosacea and dysbiosis in the gut, a disrupted gut. And sometimes it's funny because I'm all like, it's like I'm almost more interested in their skin than their gut because the skin is so apparent. You can see it. So of course I want to hear about their bowel movements and their gas and, the mucus in their stool. But it's exhilarating, Chuck, when somebody comes back and they had really bad rosacea, their skin was really blemished, and now it's cleared up. I have one patient who I started seeing as a teenager, and I don't really see patients under 18. I think he was 16, but his mom was so insistent. And I said, okay, I'm going to see him. I said, but here's the deal. He's the patient. So we're not having a three-way between you, he, and I. So if he's going to be the patient, he's going to be my adult patient. My office is going to be emailing him, calling him. She was great about it. So he had really bad Crohn's disease and autoimmune disease of the gut. And he had been on immune suppressing medications like steroids and biologics, and he was really sick, and he had terrible acne. This is a good looking kid. And I felt so badly for him because, he's 16, 17, 18 with this terrible skin. He was really malnourished. He was eating a lot of junk food. Unfortunately, his previous gastroenterologist told him, doesn't matter what you eat, just take the drugs. And he and his mom were really interested in a different way. So we employed our usual food as medicine program, lots of plants, beans, greens, all of it. And would focus on the skin. So I'm going to sort of not get into too much detail about the Crohn's. I remember he came to shadow me one day. He was interested in healthcare right before he went to college. He came to shadow me in the endoscopy suite. Then he went to college. He went to University of North Carolina, and he's now doing a master's in nutrition. He's been off all his Crohn meds for a while. His Crohn's is in total remission. His skin is glowing, and he's done so many cool things out there with his focus on nutrition and, now doing this master's in nutrition. He's gotten scholarships. He did research with me. So Noah, I salute you. I'm so proud of you. What he was able to do for his gut, he was able to do with his diet by really focusing on a plant-based approach. He was able to heal his Crohn's in a way that his biologics and steroids did not. And for those of you who are thinking, do I have to be completely vegan? I fully respect the work that PCRM does. And I also want to say, though, that just increasing the amount of plants you eat can go a long way. So for people who don't feel ready to make a full commitment to plant-forward eating, if you are struggling with your skin, if you're struggling with autoimmune disease, and you make a commitment to increase the amount of unprocessed plants, to add a green smoothie in the morning, to add a salad at lunch, to add some beans at night, you can and you will see dramatic improvement. So it doesn't have to be all or nothing. Eat more plants. And so this patient, he had this dramatic improvement in his Crohn's. And we see this, we have about a 79% success rate with our patients. And we have a program for IBD too called Drug-Free IBD, remission without immunosuppression. But his skin was also really dramatic. And again, it comes back to this relationship, right? Because what's going on your skin is a reflection of what's going on inside your gut, and vice versa a lot of the time. And so as his gut microbiome healed and improved, his skin microbiome healed and improved, and it was rebalanced. And one of the things I want to point out, Chuck, it's so important when we're dealing with acne. So often, and particularly in young people, they think it's dirt, right? It's oil, and I'm going to wash my skin, I'm going to cleanse it. When you wash your skin too much and you use harsh products and you strip the oil off, your skin then produces more sebum, right? Because it's a feedback loop. The sebum, you have the physical barrier of the skin, the squamous cells, and you have a chemical barrier of lipids, of fatty substances that are produced. And that's there to reinforce the physical barrier of the cells and to protect the skin and to keep it moist, etc. And so when you start stripping that away with all the cleansers, now your body goes, oh, skin is really dry. Let's produce more sebum. So that is not always a good idea. It's not the sebum itself that's a problem. It's that it's getting clogged in the ducts. It's mixing with bacteria. So again, if you've been on a lot of antibiotics or you've been using a lot of antibacterial products on your skin, and that's really stripped your skin, it's disrupted the skin microbiome. Now you have overproduction of sebum. Now you have a perfect storm for more acne. So I really encourage people to take a gentler approach, to not try and wash or scrub their acne away, and to be gentle to your skin. The less you put on your skin, the better it's going to be. I struggled with rosacea years ago, and I found that the less I cleanse my skin and put products on it, and the more I just allow my skin to be and to breathe and to allow the microbes to live harmoniously without attacking them and trying to sort of fix it with products, the better my skin got. So the same is true for acne. Overwashing is a major problem. Putting too much topical stuff on it is a major problem. So the whole point of the Gutless Guide to Healthy Skin is this idea of how can you heal your skin from the inside out? And it doesn't mean that we don't rely on some of these medications, not the antibiotics, but there are some topical things that can be helpful, but you don't want to overdo it. You want to try and allow that ecosystem of microbes on your skin to regain its balance and equilibrium and then do its thing and produce healthy skin.
You know, Dr. Chutkan, what is abundantly clear to, I think, everybody who's watching and listening today is you spend an inordinate amount of time reading these medical journals and schooling yourself. You're always raising that health IQ. You got a lot of knowledge up there in that noggin of yours, my friend. That is quite impressive. We got to keep things moving because there's still a lot that I still want to get to with you here today. But really quickly, you mentioned greens and beans as two of the foods that could really potentially help in terms of acne. What are some other specific foods that people might want to look at piling on their plate to help here?
So I want to start with something really basic, and that's water. The gut is simple plumbing, and the skin after the gut is the body's second largest organ of excretion. The skin is about the gut is about 10 times larger in surface area than the skin, but a lot of the way that we get rid of, whether it's bad food we've eaten, toxins we've ingested, etc., is we excrete it. So in the case of the gut, in the mouth and out the butt, that's how we excrete it. But with the skin, we also are excreting things all the time. And if you don't have enough water on board, if you're dehydrated, you're not going to be really flushing out those substances. So minimum half your body weight in ounces of water. If you weigh 150 pounds, it's 75 ounces of water, minimum. Plain water, not vitamin water, not alkaline water, not enhanced water, plain old water. Filtered water, if you're not so sure about the tap, is fine. Sparkling water is fine, but not water with stuff added to it. So that's really important as a way to sort of flush things both out of our GI tract and out of our skin are important. Leafy greens, the most underconsumed foods in the American diet. One of the most important, they contain all those polyphenols. Plants contain flavonoids, polyphenols, etc. But the green leafy vegetables are so important for healthy skin. A green smoothie is a great way to just get a bunch of veggies in the morning. For mine, I like to use a coconut water base. And then I usually do 2 or 3 leafy greens, kale, spinach, collards, usually a stick of celery for extra fiber. I use a little bit of fruit for flavor, green apple, nectarines, whatever I have on hand, ice, parsley, lemon. Again, you can find the green smoothie recipe on gutless.com or in the Gutless Guide to Healthy Skin. I have a couple variations of it, but it is a game changer for healthy skin because you're blending up those nutrients, you're drinking them, and you're getting a concentrated, like a mega vitamin dose in a way that an actual vitamin could never give you, because that's never as good as real food. So that's another, and you're hydrating with liquid. So that's another really great one for that. And then you have things like the brightly pigmented foods are important. So things like carrots and sweet potato, the oranges are really important, the reds, red peppers, tomatoes, all of those things. So the way nature did it to make it easy for us is they put the different nutrients in the different pigments. So red foods, orange foods, purple foods, green foods. Sadly, so many of us are eating brown and white foods. We're eating some kind of white, starchy, potato, rice, etc., and some kind of brown meat. Or so we want to, and not to say that you can't eat that stuff and have healthy skin, but you also have to include the deeply pigmented things. So particularly the reds and the oranges for healthy skin, plus the leafy greens are really key. And really, there's very few foods from nature that are going to hurt you. So if you don't like carrots, but you like sweet potato, or you don't like tomatoes, but you like red pepper, that's fine. You want to eat a variety. We know from the American Gut Project study in 2018 that 30 or more different plant foods per week is really an important marker for building a healthy microbiome. And that's true on the skin too. So you don't want to just get into a peas and carrot in heavy rotation situation where you're just eating the same thing all the time. You want to throw in a little variety. But the cool thing, Chuck, is it doesn't have to be a lot. Like literally eating 2 strawberries is still giving you some lycopene. Eating half a red pepper, eating 1 carrot, you're still getting tons of nutrients to feed your skin with that.
All of which go to producing that healthy, glowing skin that we're looking for. Let's go on and talk a little bit about eczema and psoriasis. Let's fold those two together. Number
Sure.
one, both of these can be considered autoimmune conditions, correct? And
Yes,
so
absolutely.
that's a little bit different than acne. So, what are some of the common causes of this? Is it just generalized gut inflammation? Or again, is there something that we're consuming, something in the way that we're living our lives that can really, flip on that gene that says, yeah, let's hit this person with eczema and psoriasis?
It's actually both, Chuck. So autoimmune conditions, and we're up to over 100 different ones. And for the skin ones, psoriasis and eczema are 2 really common ones. Rosacea is also autoimmune, but they're multifactorial. For many of them, there is a genetic predisposition, but there are environmental triggers. Environmental triggers, diet, lifestyle. So what you're eating, stress, all of these things. And this is true for virtually every autoimmune disease. There was a Swedish study, pardon me, that just came out, and it's sort of top of mind because I talked about it in this latest Gutless podcast episode on psoriasis. So this Swedish study used babies from this registry called ABIS, which is all babies in Southeast Sweden. And the Scandinavians are really good about participating in these clinical scientific studies. So we get great data from them. They asked the question specifically looking at psoriasis. Number 1, is breastfeeding protective against psoriasis? And the answer was a resounding yes. Babies who were breastfed for less than 4 months had much higher rates of psoriasis. And we know this is true for other autoimmune diseases too, for Crohn's, colitis, etc. So breastfeeding, there are ingredients in breast milk, human milk oligosaccharides that feed the baby's bacteria that help to build the baby's little army of microbes. And that leads to a healthy immune system, etc. So breastfeeding is protective. They also found that introducing milk into the diet was a trigger for psoriasis. We've seen the same thing for acne. And in this study, eating a lot of fish from the Baltic Sea. Now, fish from the Baltic Sea, in Sweden, people know where their fish is coming from. They can specifically say, okay, this fish is from the Baltic Sea. Has a lot of toxins in it, specifically heavy metals. And they thought in this study that might be contributing. But you might be hearing this and going, okay, well, I was formula fed and I drank a lot of milk in childhood, but now I'm 40 and I have psoriasis. So what can I do about that now? We know that diet now, even after all of these risk factors, it still is the most powerful tool we have for changing what's going on in the gut microbiome, for influencing the immune system. So I had on that episode a friend of mine who suffered with psoriasis since she was about 12. And her story was that she's from Jamaica like me. She moved to Canada, to Montreal, when she was about 10. The food was totally different. She grew up eating food cooked by her family, all fresh, local, that was really grown in the neighborhood. And she moved to Canada, was eating ultra processed food, a lot of pasta and canned food and pizza and candy. It was very stressful, change culturally for her. And by the time she was 12, she was covered with psoriatic plaques on her scalp, etc. She went on for the next 4 decades to be treated primarily with steroids. She was put on biologics about 20 years ago. She had psoriatic arthritis. And then, with a little nudging from a good friend of hers who happened to be a doctor, she changed her diet. She's a really good cook and really started doing more soups, smoothies, plant-based eating, cooking most of her meals. She stopped drinking alcohol, mostly, not that she was a big alcohol drinker, but really none of those processed foods. And remarkably, she's been off biologics now for about 2 years. Her psoriasis is better off the biologic and off the steroids. It's just remarkable. It's remarkable. And, we think that that's magic, but it's the opposite way around, Chuck. Like, of course, what you eat affects what's going on in and on your body. So it's not that eating and living healthy is magic. It's magic to expect these drugs that suppress our immune system to heal things and not do damage. We know that immune suppressing drugs are going to cause cancer. Can cause cancer, can increase our risk of infection. So to me, and again, I am all for conventional pharmaceuticals. I prescribe drugs. I wear a white coat. I'm a conventionally trained doctor. But I am for judicious use of medication. And that is not what we are seeing now in 2024 in the world, not just in the US. Doctors are heavily incentivized to prescribe these drugs because in the case of biologics, they're making a ton of money by prescribing them. They're infusing them in their offices. They're making lots of money. We're seeing the same thing with other drugs, which shall remain unnamed, that people are using for diabetes and weight loss, et cetera. And so while these drugs can be powerful, they can be life-changing, they can be life-saving for some people, we are seeing, it's like prescribing gone wild. And we're seeing these drugs prescribed for conditions where they are not needed, where a really strong commitment to diet and lifestyle, maybe with a less toxic medication, can help. For my friend, she's using a topical coal tar ointment that's working really well. And again, I have information about that in the Gutless Guide to Healthy Skin, some of the topical, less toxic things. So the goal is let's just not use a medication that could potentially kill you unless you really have to. That seems to be common sense. To me, that's not a radical idea. Let's reserve the big gun drugs that can cause serious infection, cause cancer, and kill you for when you've exhausted everything else. And that's what we call a step-up approach. What we're seeing now is a top-down approach. We're let's just start with the most, toxic, dangerous drug that, yes, it's super efficacious. But what I just find so interesting about my friend's experience, and the same thing with my lovely colleague, Noah, who started out as my patient, is that they're getting better results with diet than what they were getting with these really toxic medications. And again, for somebody out there who's on a biologic and it's been life-changing, I'm so glad for you. And I'm so happy these drugs are available. And I mean that sincerely. I've prescribed many of them in my career, and I think that they have been an incredible scientific breakthrough. But what I'm trying to plant here is a seed that there are people out there who don't need the drugs, who can do other things like manage your stress. In the case of my friend, she left a really stressful job she'd worked at for over 30 years, and she had the luxury to do that, which was great. She started exercising regularly. She really started paying attention to sort of her mind, body health. And that helped tremendously too. And I recognize not everyone's in a position to quit a stressful job and, spend hours working out and cooking. That's not reality for a lot of people. A lot of people need these drugs, but it doesn't have to be either or. Even if you are on a drug for psoriasis or something for acne, you can still start making these changes in your diet and your lifestyle and how you approach your skin topically, the products you use. And if you see improvement, that might be the time to talk to your doctor and say, hey, do I really still need this other drug, or could I use less of it? Or, is there a less toxic version? So that's the goal, to really have an integrated approach where we do have the prescription medications available, but we rely on them only when necessary. And we do what we can do. We, as I like to say, we pay attention to the input so that we can have a different output, and maybe we won't need them, or we won't need as much of them.
Again, I'm just sensing a future podcast series here. But I do like your message. The way that we're doing it now shouldn't necessarily be the frontline approach. Let's not make that the
Yes.
first line of defense. Let's try these other things first, and then see if you still might need them. And long run, that may change the outcomes for a lot of people. Circling back to psoriasis and eczema, when it came to acne, when I asked you the question about the best foods, you said a lot of brightly pigmented foods in there, also leafy greens. Is the prescription in the kitchen much the same for psoriasis and eczema?
It's the same. It's the
Okay.
same. With eczema, there are some additional things. So, for example, my husband developed severe eczema in his late 40s. It was terrible. It was over his eyes and on his legs. I mean, he has fungating lesions, patches, and he went to about 4 different dermatologists. He went to an infectious disease doc. He tried everything: bleach baths, topical steroids. They wanted to put him on a cream called tacrolimus, which is actually kind of like chemo. It's a drug. It's a topical form of a drug we use to suppress rejection in people who've had organ transplants. When I saw that, I was like, oh no, we use this in people who've had liver transplants. This is a serious drug. And yeah, it works, right? But do you want to be on a serious immune suppressing drug like that? So everywhere we went, we asked about triggers, food, etc. And one dermatologist, really lovely, she was like, well, it could be anything. Could be the laundry detergent, could be cologne, it could be, it's anything. Here, this is what you need to do. And again, it was more and more steroid cream. And he was developing fungal overgrowth. He was now starting to have some yeast growing on his skin because the microbiome was so disrupted. And we finally, the last dermatologist we saw, who's my lovely and dear friend, Dr. Paula Borelli, shout out to her in Olney, Maryland, the best dermatologist ever. She gave it a really thoughtful approach, and she did check for the yeast overgrowth because he'd been on so much steroids at this point, over a year, and she cleared that up, and that was really helpful. And then I said to him, I said, you know what? I bet you this is dairy. And I put him on an elimination diet, and I was wrong. It was not dairy. It was gluten. And it was so clear. And as our 19-year-old daughter would say, and that was the end of all our fun, because that was when instead of like baguettes and croissant and roti, and it was like, oh no, here comes these oat flour tortillas again. Yeah. So it was so clear with him. So we did this elimination diet, and I did my typical gut bliss, what I call SAD gas. So the SAD is soy, artificial sweeteners, dairy. And we didn't really eat artificial sweeteners anyway, but the gas is gluten, alcohol, sugar. The gas is like, oh, there goes all the fun. No gluten, alcohol, sugar. So we did the elimination diet, and I was so convinced it was going to be dairy. And it wasn't. It was a gluten. So once he got off the gluten, it cleared up. And the minute he started eating gluten again, it would come back. He'll still have a little bit of occasional gluten. We were just on vacation, and he did have a little gluten. I think he drank a beer one night, but then he starts to get it like up under his wedding ring, over his eyes. And then he knows, okay, so he'll have a little bit of occasional. I'd say he's about 90%. But here's the thing, he doesn't want it, because when he eats a lot of gluten, the eczema comes back really ferociously. And so it's become like, yeah. And he's not like, oh, if he goes to a restaurant, like, is there gluten in the sauce? He doesn't have to avoid it the way somebody with celiac disease does. But the gluten intolerance for him manifested as eczema. So that's the other thing that I encourage people to do. It's often helpful to do it with the help of a nutritionist or an allergist, immunologist, is to do an elimination diet and take out these various foods. And that is also in my Gut Bliss Guide to Healthy Skin. And you do this for a couple of weeks, and then you gradually reintroduce the foods, and you see, or not, right? Sometimes you take this stuff out and you're like, oh my goodness, I feel so great. I don't want to reintroduce it. But for him, it was a particular allergen in the sense of the gluten. For other people with eczema, it's not as specific, although I have had other patients tell me certainly that gluten and dairy. And we know, like in kids, dairy is a huge one for children and eczema.
Let's talk about rosacea here as we start to wind things down a little bit. Again, I mean, I hate to do the rinse and repeat thing here, but how different is the list of common foods and the best foods and the course of treatment? How different is rosacea from what we've already spoken about?
There are some differences like with the topical stuff. So for example, with rosacea, you don't want to eat or put anything on your skin that's going to cause vasodilation and cause the blood vessels to dilate, because that is going to give you more redness. So there are some histamine foods, for example. So while I encourage people to eat a lot of fermented foods in general, because that's great for the microbiome, if you have rosacea, you might find that the fermented foods, the sauerkraut, the kimchi, et cetera, give you a little bit of flushing. And so that might be a little harder to tolerate. You don't want to use anything on your face that has, alcohol in it, or products with alcohol on your skin that cause vasodilation. And you got to be careful with drinking alcohol, because that's a major trigger for rosacea. People will often find that cutting out alcohol can dramatically improve their rosacea, but that's hard. So they want, a pill or a potion or something. So we always want to start with, what is your body telling you? What is the feedback? Your body's so wise. And when it's giving you feedback, and every time you drink, your skin is on fire and it's red and it's inflamed, you got to pay attention to that. You can't just keep ignoring that and looking for a pharmaceutical remedy, right? In the case when you're getting feedback. Now, not everybody's skin gives them that feedback. Some people, the alcohol doesn't make a huge difference. But the topical products for rosacea are a little bit different. We have to be a little more careful with that. And again, I have a list in the Gutless Guide to Healthy Skin of the ingredients as well as products that you can use safely and not. And so with food, again, for some people, high histamine foods with rosacea are an issue. For other people, they're not. They're really not for me, for my rosacea, which I was able to heal. With rosacea, also extremes of temperature. I'm a snowboarder, and in the winter out on the slopes, it would get really red and hard from the cold. That doesn't happen anymore. And heat. I love hot yoga. I love steam, saunas, all of that. And now I can do that without it flaring up the rosacea too much. Sometimes a little flare up if I overdo it in the steam room, but manageable. For me, the biggest trigger for my rosacea definitely was alcohol, for sure. And so that's something that I've had to manage, and that has helped dramatically. So there are some differences for the different conditions. But again, what I encourage people to do is, be your detective, be your gut detective, your skin detective. Do it with the help of a healthcare practitioner always. You want to do this wisely and safely. You don't want to sort of go rogue. And have a conversation with your dermatologist. They'll probably look at you like you're crazy. They're like, oh, what? You will probably be teaching them a thing or two. Most of what I know about food that's useful, I know from my thousands of lovely patients over the years who are generous enough to share with me what they were doing. And I have to admit, 20 years ago, 25 years ago, I was that conventional doctor who thought, doesn't matter what you eat, eat whatever, just take the medicine. And my eyes were opened one patient at a time. So be generous with your physician and your dermatologist, and try and engage them in a conversation. Let them know, I'm going to try this. I'll let you know. Listen, when you come back and your skin is clear, they can't argue with that. And then it's going to plant that seed for them for the next patient, right? We're all learning together. We all have the same goal. We want to be healthy. Your doctor wants you to be healthy. They may just not know the particular route to that better health that you're exploring, that particular road that you're taking. And sometimes it's scary to them, right? Because they want you to do well. And you're like, well, I want to stop the medication. I want to, start drinking green smoothies. It sounds crazy to them. They're not experienced with it. But I really encourage you to enlist them in this journey, get their help, get their feedback, and, teach them a thing or two along the way, as I was lucky enough to be taught.
That's what I'm saying, man. Raise the health IQ. The discussion never stops. On the audio version of this podcast this week, I talk about a review that was left by a physician who says that they discovered the show. They've now plowed through 15 episodes, and they feel like they're learning every single time they tune in. And I was like, that's exactly what we're striving for. It's like to educate the patients and and the doctors here. We only have a couple of minutes left, but I do want to give a shout out really quickly to Dana in St. John's, Florida. Shared a pretty cool success story with us in the chat. Says, I suffered from skin condition due to lupus, had a rash on her scalp for over 7 years. Within 3 weeks of going plant-based, not only did my scalp clear, but my stomach was much better. Dana living the good life.
Dana, I love that so much for you. I am so proud of you. I'm so inspired by you. That makes me so happy because, as you know, Dana, lupus and discoid lupus, which affects the skin, can be a devastating condition. And lupus, of course, can also affect the kidneys and other parts of the body. So you stopped your lupus in its tracks by eating more plants. That is so powerful. That is so inspiring. I'm so thrilled to hear that.
Very cool. And a comment from somebody who, likes to have fun in life based on their name. Kama Sutra. I had acne on my face, moderate to severe for years. When I switched to a whole food plant-based diet, my face cleared and I had already stopped using makeup and non-vegan products. So very cool. So the proof is in the pudding, or in this case, the results. That's very, very cool. All right. Final question. And I'm also going to say,
sorry. So sorry to interrupt you. Just for Kama Sutra, I wanted to say one thing about the makeup. Yes. So often, and particularly with young people, the skin, it's not vain to worry more about skin than colon cancer. Look, this is what the world sees. This is what we present to the world. And it is very distressing when you're looking in the mirror and you're seeing all these blemishes and so on. And so often young people, they try and cover it up with makeup. And the makeup is really hard on the skin. Even makeup, when it says non-comedogenic, often it's blocking the pores, it's messing up the bacteria, etc. One of the most helpful things for my rosacea is I never wore a lot of makeup to begin with, but to not wear makeup. Maybe a little lipstick, eyeshadow. It's hard because you kind of want to cover, but letting your skin breathe is really key. And it sounds like you found some products, Kama Sutra, that were helpful for you. So that's another thing, that if you let your skin breathe and don't try and cover, eventually you won't need to cover.
All right. And let's go ahead and just extend the invitation to you to come back, because there's going to be a lot of leftovers that we're not getting to today just based on time. But let's definitely get you back on the show so we can plow through a lot more of these questions, because I really think that we touched on a lot of things today that are going to be very beneficial and weighing on the minds of the exam roomies moving forward until we get them the answers that they deserve. But final question, if you have time, we can answer this one hopefully pretty quickly. Comes to us from Victor R., who says, besides fermented foods and fiber, what do you suggest is best to restore microbiome after antibiotics? Obviously, we talked a lot about those here on the show today. So what would you recommend then, Dr. Chutkan?
Sure. And Victor, that's a great question. Of course, my best advice is to not take the antibiotic unless you absolutely have to. But let's say the horse is already out of the barn, you've taken an antibiotic. Fermented foods are important. Also, you can make a mushroom tea using maitake or shiitake mushrooms. I might not be pronouncing them exactly right, but you would use a dried mushroom caps and steep them in water for a few minutes in hot water, let it steep. So mushroom tea is really helpful for that. You also have to think about the liver, because the liver is also affected by antibiotics. So again, after antibiotics, this is a time to not be drinking alcohol while you let the liver, the gut, all of that. Alcohol also kills bacteria in the GI tract. So that's really important. And then foods that are really kind of restorative for the liver. Again, it's hard to get away from the beans and greens, right? The dark green leafy vegetables, super helpful. There are some probiotics out there that can be helpful too, but I want to emphasize that probiotics are not the main game changer. It's really going to be the diet that is really helpful in this case after antibiotics. Victor, the other thing to remember with the diet is, yes, these foods can help. The fiber is important because the fiber is actually feeding the microbes. And so after the antibiotics have decimated a large population of your microbiome, you want to encourage the growth, for example, of things like Faecalibacterium and Prosnitzii. They make the short-chain fatty acids that keep the gut lining healthy, that keep the immune system balanced and functioning well. And so all those fibrous foods, if you're cooking broccoli or asparagus, you want to eat as much of the stem as possible, because that's where a lot of the fiber is. And again, a food like legumes, like beans, also high fiber, that is going to, a lot of that poorly digestible fiber that is going to feed the microbes so that they can produce a lot of short chain fatty acids. If you have taken antibiotics and are struggling with yeast overgrowth, there are some data that things like coconut-based products, whether that is, using coconut milk or coconut oil, can be helpful. But you also, too, if you're struggling with that, want to think about taking out as much of the refined sugar as you can so that you're not encouraging the growth of the less helpful species. And it's not like there's a magic superfood out there that you eat and now everything gets back to normal, right? It's really thinking about balance in your diet the same way we think about balance in the microbiome. So what are the things you want to avoid? The alcohol, the processed sugar, the refined grains. What are things you want to double down on? The beans, the greens, the fermented foods, if you're tolerating them. And then things like the mushroom tea, etc., can be helpful.
All right. Wealth of information. Dr. Robynne Chutkan, I just love it. You are like super, super, super smart. And you have this brand new podcast, the Gut Bliss podcast, and there's a link to it in the show description and in the episode notes. I can't wait to tune in and give it a listen. Another great avenue for us to all work together in this community to continue to educate and inspire. Like, I'm sure that you're having a blast with this thing.
I am having a blast with it. It's really funny when you go on the platform and you're like, oh, 1,600 people downloaded my podcast today. But here's the thing, Chuck, like you, like Dr. Bernard, like, all the folks at PCRM, we have valuable information and we really have a duty. We have an obligation to share that with people. And there is so much snake oil out there. Can I just say it? Like, you don't need to eat vegetables. Just mix up these green powders. I mean, there is so much snake oil. And so I think those of us who are in it to really help people. I mean, not to say we're not trying to make a living, right? Sure. But whose main goal is I want to improve someone's health. And if I can have a small hand in that, that is incredibly rewarding. And that is 100% the mission for you guys at PCRM. And I feel like I'm such good company here. And so for people out there, I want to say, you have to be careful where you're getting your information. If you're getting your information from a website and then it's like, oh, and here's $500 worth of supplements that are going to clear up your skin, have one eyebrow raised a little bit, right? It's one thing if somebody's trying to sell you a recipe book or a regimen or something, but the overselling of the supplements as the magic cure for everything, you should have a little bit of one eyebrow raised. And of course, PCRM is a great place to get your information.
Well, we appreciate that. So is gutbliss.com. That is your website. There's also a link to your social media channels in the show description and the episode notes. It's a one-stop shop for everything that is Dr. Chutkan right there.
Poop Nirvana.
Well, listen, thank you so much for your time. This has been great. Can't wait to have you back on, Doc.
Thank you, Chuck. It's always such a pleasure. Thank you so much for having me.
And I also want to say thank you to you exam roomies for tuning in and raising your health IQs, asking such great questions. Again, if we didn't get yours today, have no fear. We will save them, do our best to get you an answer on that upcoming episode. Remember, she's coming back, so don't you worry. And to the crew behind the scenes, thank you guys so very much for making the magic happen as well. And on behalf of everyone here at the Physicians Committee, I am the weight loss champion, Chuck Carroll. Thank you so very much for watching today. And until next time, keep it plant-based.